Hi, you must be Tiffany.
Hi.
I'm Ollie, the pharmacist. Please have a seat.
Thank you.
Welcome to CVS. I see you have a new prescription for Spiriva HandiHaler. Can I please confirm your date of birth and name, please?
Tiffany G. July 19, 1970.
Perfect, thank you so much. Do you mind if I go over this medication with you since it's a new prescription?
Sure, I do have a few questions about the medication as well.
Awesome. I'll be happy to answer any of your questions about the medication, but first let's go over the most basic concepts of the medication. This medication is usually prescribed for COPD or sometimes even asthma. Did your doctor tell you why you're prescribed this medication?
He said it's for COPD.
Perfect. So this Spiriva inhaler is a LABA inhaler. What that stands for is long-acting beta agonist. And so what it does is it reduces the amount of exacerbations you might have and alleviates all the symptoms associated with COPD. So now I want to talk to you about the administration and dosing of this medication. So this medication, you're going to take it 2 puffs of the medication, and that should last around 24 hours. Now, when you take out one of the capsules, the insertant, that capsule, you're going to take 2 puffs. Each of them will have 2.5 micrograms of the active ingredient needed to do this. So what you want to do is you want to open it by pressing on the green button and then insert the capsule. Then you want to close it until you figure a click all the way near the gray base. What you want to do then is press and release the green button, but do not shake it. You want to put your lips around it after you have breathed out fully, and then breathe in the medication completely until you hear it, almost feel it in your lungs. You'll feel like a little rattling noise. Once you feel that little rattling noise, you want to release the medication and release it off your mouth and just hold it there for about 5 to 10 seconds. And then you want to breathe out and then repeat the same exact thing because you're taking this medication twice to get that active dose. Remember that? And then immediately, well, I also want to recall that you don't ever want to swallow this pill. This pill is literally only to go into the inhaler. A lot of people have always mistaken it with other pills that they're taking. So always constantly keep these 2 separate from anything else.
I heard all inhalers are steroids, and I don't want to put any harmful steroid in my body.
I see. So this medication, like I told you before, is a long-acting beta agonist and actually has very low systemic effects, and most of the effects just your lung area. So, but the onset of action is going to take about 30 minutes to actually really feel like it's starting to work. But you really want to remember, even with that time, this only should be used as a maintenance inhaler and not as a rescue. You want to keep strictly your albuterol for the rescue inhaler. But since you are worried about it, I want to talk to you a little bit about the side effects that you may have with this inhaler. So you also can experience dry mouth, cough, bitter taste, and you might experience some respiratory infections. So if you ever hear really tightness of chest, or if you feel like you're just having a little more trouble breathing, you definitely want to seek your medical provider for that. And so when using this medication, after every single use, you want to rinse your mouth thoroughly of it. And I also want to rinse the inhaler daily as well. So you want to use really warm water to make sure to clean it and leave it out to air dry. You don't want to use it until the next day. And so you want to store this medication in a cool, dry place. And this specific medication expires on December 2018. So you really don't want to use it past then if it really stays past then.
Okay, I'll try to remember.
Okay, perfect. So your doctor will also want to follow up with your progression with the medication, and he wants to schedule probably visits as often as he thinks is necessary to assess how your symptoms of COPD and how you're dealing with it. They also want to check your spirometry test to measure how your breathing is improving with it. Now, this medication is proven to be very efficacious when used appropriately, whatever dose your doctor has prescribed. However, this medication has shown results to increase tolerance of this medication. So if you ever feel like your medication isn't doing as effective as it used to be, you definitely want to follow up with your doctor to improve those symptoms. And definitely the benefits outweigh the risks of this medication. And so definitely you want to follow up until you feel like there is obviously a side effect or something that becomes intolerable. By any chance, do you smoke?
1 pack per day.
If you don't mind, may I go over some benefits of quitting smoking with you?
I don't feel like quitting right now.
I understand. Sure, I just want you to be aware of that quitting smoking does help alleviate your COPD symptoms as well as definitely a healthier lifestyle to live. So I'm always here to talk about this if you have any questions.
Okay.
I know I went over a lot with you today. Do you have any questions, or can you tell me generally if any other concerns I can help alleviate?
No, you did a good job on going over it with me. So just 2 puffs every day around the same time and rinse my mouth afterwards, right?
Perfect. If you have any questions, of course, me or anyone from the pharmacy staff can always help you.
Okay, thank you so much for
Thank
your
you so
help.
much.